Back pain that he's had for years. Does have a bulging disc that gets flared up sometimes. Most of the videos that you're seeing on YouTube, you're probably seeing where we turn them sideways and crunch. What if you're a person who has a bulging disc, herniated disc, even if you've had back surgery and you're wondering, could a chiropractor still help me? For Brian, we are choosing to do some of the less invasive procedures so that he can have some results without aggravating that disc more. So what we're going to start with is just a long line up the spine. Getting really deep into deep tissue work. You don't want to just dive into that tissue. You want to give it a little warm up. All right, we're going to start getting deeper into that tissue. How am I doing on a pain scale?
A little high.
At 8?
Yeah.
Okay. So he's at an 8, so we're going to back off. What I'm doing now is I'm getting deeper into where his disc issue actually is. And I don't know if you can see from the camera angle, but so I'm not pushing down. What I'm doing is I'm taking a kind of the lateral of my thumb and pushing that tissue, okay? So your pressure is actually coming here, and it's more of a translation, okay? So picture there's like a bubble, and you're trying to push this bubble out. And you're always wanting to push toward the heart, okay? So the cardiovascular system can pick that up and get all of that out of the patient. It's just a little bit of swelling and some different chemicals that the body produces when it's in pain. So you're pushing everything toward the heart is the direction that you're going. What I'm working now is actually a little bit lateral to the spine. Lateral means to the side. So he has the herniated disc in his lumbar spine, but lateral to the spine in your low back. If you watch someone from behind, you can see they have those two dimples. That's where the two hip bones are coming together with the sacrum, which is a triangle bone in the center. And that joint is called the sacroiliac joint. And a lot of times there's rotation in this pelvis, and that rotation is creating an unstable foundation that the spine is having to deal with. And so if you work with that sacroiliac joint, make sure the pelvis is a good even foundation. Now as the spine builds from there, it can just build straight and true. Does one side bother you more than another?
That's right.
Yeah, okay. The next thing we're going to do is we're going to show you this gentle adjustment. The first thing that we're going to do is use an activator. An activator is a tool that delivers a little bit of a force. So I'm going to show you that now. This is the activator. It's just a little tool. It has a rubber tip on the end. We pull this trigger, and you can see, watch the tip. It delivers a very quick thrust. So what we're able to do is deliver that very quick thrust in a gentle way in the exact motion that we need it to go. So it's gentle, but very effective. Now I'm going to go out onto that sacroiliac joint. It's lateral to the spine. So his spine is here, lateral, out here. This is is not painful, but it will give you relief, okay? So if you've had surgery or you're just afraid of all the cracking, we have options. So you would just call the office of the chiropractor that you're considering and ask them if they have and do activator technique. The last thing I wanted to show you is what is called drop table technique. So one thing that chiropractic tables can do, not all of them, but this one does in particular, is it can prop up just a little bit. That gives us the opportunity to use physics to our advantage. So if you think about, as this is falling, at the point that it stops, the motion that we're creating with the line of drive is going to continue. So this is physics in motion that we're using to our advantage. In the line of drive, we're needing that pelvis to go. So it's very, very comfortable for the patient, but we are able to move these very big pelvic bones. It'll go up, not very far. It's going up just about this much, okay? So then, this pelvis here, this ilium has rotated backwards. It's called posterior inferior. And I just diagnosed that by a few things, checking out the leg length and the horizon of the pelvis and which side is high. Easy diagnosis for us as chiropractors, so that's what he has going on. So we're gonna go in the line of drive to push this pelvis ilium back this way. So my hands will be here and we're going this way. Good. That was surprising, your body jumped, but did it actually hurt you?
No.
So it is surprising. It's hard to explain to someone what it's going to be like, but just like Brian said, no, it doesn't actually hurt. It's just surprising. And were you able to feel that ilium move forward?
A little bit, yeah.
Yeah. So sometimes you may not even feel it move because it is very, very gentle, but it's a wonderful technique when you have that pelvic imbalance that's creating a hard time on the disc because your spine is crooked and having to make up for the fact that the pelvis is off. I hope that this has been helpful for you, and I thank you for coming along and joining us today. It's so helpful. If you will, please subscribe to my channel, and if you like this video, please hit like. It helps others know that it's a video that might be worth watching if this applies to them. Have a great day.